See Dr. Lederman, 212 Choices. 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, we're back. We just got a caller. I was just trying to get them to hold on until the commercial, and they hung up. So if you have a question, please call us back. We're happy to answer your question. There's another news article that was just published. It looked at survival of cancer patients. It was in the Journal of Clinical Oncology, which is one of the major cancer journals in America. It was an article by Matthew Stingler, and he writes that in the UK, so it's from Great Britain, population study reported in the Journal of Clinical Oncology, Cardwell found that statin use, so these drugs to lower cholesterol, after the diagnosis of colorectal cancer was associated with a 29% reduction in colorectal cancer mortality and a 25% reduction in all-cause mortality. The improvements were greater in patients taking statins for more than a year. So the study involved more than 7,000 patients with newly diagnosed colon cancer, or rectal cancer between 1998 and 2009 in the United Kingdom, and then the patients were followed. 2,600 of the patients had used statins. Statin users were more likely to be diagnosed more recently, to be older, to be men, to be smokers, and they had a significant reduction in cancer recurrence and death. Statin use after diagnosis was associated, he writes, with significantly reduced risk of colorectal cancer death and decreased death of all patients. Statin users, he writes, had a significant reduction in all-cause mortality. So it's an interesting study. For those of you who have colorectal cancer, you might want to look at that study. There was about a 25% reduction in mortality after colorectal cancer. Doesn't mean you don't need your treatment still, but this is in addition to best treatment. If you have a question about it, you can call us at 212 Choices during the work week, 212-246-4237. Another man we treated a year and a half ago for gastric cancer. He had stage 4 gastric cancer almost 2 years ago. He presented with stage 4 cancer. So the cancer was in his stomach and in his liver. We treated him with radiosurgery. He went into complete remission. He was seen by his surgeon and other doctors who were following him with CAT scans. CAT scans are not the best way of following a patient. And he was told by his scans at the other hospital, and it's a big, famous hospital nearby, that everything was A-OK. He came to me after a long gap, and sometimes people don't come back as they should, and we obviously tell people to come back, but some people think one doctor's too much, and maybe one doctor's one too many, some think, and they're maybe right. But in this case, he came back to us, and we staged him back. Now, he had just got a CAT scan a month before, and he was told everything's A-OK. We staged him up. We evaluated him. Actually, when I looked at the report of the CAT scan, the report said there was a suspicious lymph node in the chest. So it wasn't exactly A-OK. He was told that, but he wasn't given copies of the report, which we gave him. Then we staged him up with a PET CT scan, and we staged him up. In fact, that nodule in the chest was fine, but he had more cancer in the liver. So he was a bit shocked, to say the least, that he'd been told a few weeks before everything was A-OK. But imagine he had gone another 3 or 6 months not knowing the truth. So we were able to tell him what's going on. He has copies of the reports. He has copies of the images. And he's, I'm sure, going to go back to his surgeon and ask why he was told everything's A-OK when it's not A-OK. We offered him all options. Obviously, you can have chemo or surgery. Most people choose radiosurgery. He's had great results. He's had control of the cancer in the stomach and control of the cancer in the liver. These are 4 different spots in the liver. The spot we treated with just 5 treatments went away, stayed away. It's now nearly 2 years later. So we wish him well, whatever he chooses. And if he chooses us, we would do the best as we did last time. And last time we made the cancer go away, which is what we want to do. We have another man with kidney cancer. Earlier in the show, I talked about a man with kidney cancer who, unfortunately, was going to have half of his kidney removed and put on dialysis. And luckily, he came to us, and we found that his kidney was normal. Yes, there was a cyst, but a lot of us have cysts. Cysts don't really cause harm, just general cysts. This man that I'm talking about had a kidney removed also. He didn't know about us, and now comes to get checked out because of pain in the penis. We staged him up and actually found that the cancer came back in the opposite kidney. He does not want dialysis. He does not want surgery. Surgery for the kidney did not work the last time. He does not want it again. We're going to do radiosurgery to the kidney, and to evaluate the pain in the penis, we looked inside the bladder and actually found a mass in the bladder unrelated to the kidney. So we're going to take care of both things, the bladder and the kidney, and try to get him into remission and do the right thing. Just want to talk a few minutes about cauda equina. We had a woman with breast cancer who came in with cancer that spread to the cauda equina, and earlier in the show we talked about we've treated cancer most everywhere in the body. The cauda equina is a Latin term for horse's tail, and where the spinal cord ends, it turns into little filaments that look like a horse's tail. Well, her cancer spread to the cauda equina. How does it get there? It gets there through the spinal fluid. So it's stage 4. She has no symptoms right now. We treated the cancer with focused beam radiation. She tolerated treatment well. We're staging her up to see if, God forbid, there's cancer anywhere else in the body. Cauda equina, cancers there sometimes can cause strange symptoms and cause numbness around the anal area or genital area. It can cause numbness in the leg or leg weakness. Luckily for her, she has no symptoms. But for those of you who have numbness, if you do have numbness in your bottom or legs, you may want to come in and get tested. It's a serious condition. Luckily in her, we've treated her and she's doing great, and we hope she continues to do great. There's a new study from Taiwan that shows an increased risk of head and neck cancer in those with diabetes. This was published in JAMA, and it looked at thousands of patients, 89,000 patients from Taiwan with diabetes, and found increased rates of cancer in the head and neck area. So again, it might be a warning sign if you have any lumps or bumps in the head and neck area. We're just about at the end of the hour. My name is Dr. Lederman. We're a cancer treatment center, Radiosurgery New York. We're located in the heart of Manhattan, and we're devoted to trying to take care of you. We are a private cancer center, which means we work for you, not the drug companies, not the surgeons. We're not only super convenient, but I think we're super. We spend time with you. We answer your questions. We're close to most all subways, buses, trains, Grand Central, Penn Station, Port Authority. We try to send information to you if you have questions. We try to answer your questions and spend time with you, not rush you, so you understand everything. You have the paperwork, and you can read and understand about your body. We urge people with cancer to get second opinions. If you have cancer and if you're not being successfully treated or you're not tolerating treatment, you may want to give us a call at 212-CHOICES. There may well be options available for you, like we've discussed on this show today. We do have another show tonight on WOR at 9 p.m. If you have questions in between, please call us at 212-CHOICES, which is 212-246-4237. Thank you, God bless you, and bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 12